I love translation. I love the way it opens a window into language so that we can access the knowledge that's behind it. But when we don't have translation, then language is a door that keeps knowledge out. And this isn't much of a problem for us because we are English speaking. And most of the world's knowledge is contained in English. But for most people in the world today, language is a barrier to knowledge. And we're talking about the very people in the world who don't speak a world language like German or French or Chinese or Spanish or Japanese. The very people who need health information the most have no access to it because of language barriers. This is what the world looks like if you don't speak a major world language. And that's why I'm here today. I'm here today because as academics, as students who are going to go out in the world and do great things, I want to be really sure that you hear the forgotten voices of the poor and the rural. And even though I'm speaking about the developing world, I just want you to know that language is a door to knowledge here in America, that people here in America have worse health outcomes because of the barriers of language. I founded Translators Without Borders because of this passion I have for access to knowledge. Our three goals are to support nonprofits with translations, to take down language barriers to knowledge, and to raise awareness of the role of translation in facilitating access to knowledge. And it's in service of this last goal that I'm here today. And I really appreciate Tufts giving me the opportunity to speak to a group that isn't in the translation industry, that is going to go out into the world, and we want them to carry that message. These are some of the nonprofits that we support: Wikipedia, Action Against Hunger, Doctors Without Borders, Partners in Health, a lot of wonderful organizations. We support them with free translations. Since 2011, we've been able to save these organizations around $2 million. That's $2 million that they can use in the field. We've also helped them raise perhaps 3 times that much. So this is important work. We help them communicate, we help them fundraise, talk to their donors, train their staff. And this is important work, and I love it and I'm proud of it. But this is just a fraction of the need. It was in this village in Thicke, Kenya, about 3 hours out of Nairobi, when I realized what a huge global challenge we have in terms of access to knowledge. As you see, they have good health information. That community health manual is excellent. It's put out by AMREF, very locally relevant. The poster, cholera, we just had that brilliant talk about cholera. I think later on in the day you're going to talk about pictograms. Well, pictograms, that's a real tough one. If you didn't understand English, how are you going to understand that man drinking a glass of water? How is that going to save you from cholera? So this is the issue we have. This poster is in a village where only the school teacher and the pastor speaks English. Even the healthcare worker speaks only a little English. So how are they going to benefit from this knowledge? And why is written knowledge so important? Because certainly people can speak the message of good health, of clean water from one person to another. But this is something I studied in psychology, that when you listen to a message, you retain only a small percentage of it. In fact, I spoke to Doctors Without Borders physician in Kenya, and he tested this, and he found that his patients remembered 20% of what he said, and 10% of that was wrong. So written information is important for us. You read books, you don't just listen to lectures. It's important for them, and especially in Africa, with 25% of the world's disease burden, 2 to 3% of its doctors and nurses. They're educated and they come to us. They're in Canada, they're in the States, they're in Australia, they're in Britain, but the doctors and nurses aren't necessarily staying where they were trained. And that's a big problem. Where we might have access one doctor to 500 people, in Ethiopia, the World Bank tells us there's one doctor for 40,000 people. Written information can fill that gap. Another solution they have, this is Thicke, who's 12 years old and a grade 7 student. She's HIV positive, and both her parents died of AIDS. She wants to be a doctor, and I hope she will be. One of the solutions that, and it's actually a brilliant solution, that the African governments have come up to this problem of lack of healthcare professionals is to train a vast army of community healthcare workers. There's a big problem here. First of all, this army of community healthcare workers, they need to take care of people like Thicke with extremely fragile health. When you have AIDS, you're subject to any kind of illness or disease that's going. So these healthcare workers, who may be educated, who may not be educated, who may speak a European language or who may not speak a European language, are almost universally trained in either English or French or Portuguese. So the people who are in the front line of healthcare, who are taking care of people with the most compromised health on the planet, are trained in a language they may or may not speak. And the fact is, more people die from lack of information than from lack of medication. We're getting pretty good at distributing medication, of making medicines for tropical illnesses available. But if people don't know when they're needed and how to apply them, what dosage, and under what conditions, what good does it do? The former head of UNICEF, Dr. James Grant, said that during his tenure, 90% of the children who died needlessly. They died because the knowledge to save them wasn't where it was needed, when it was needed. I'm sure you all know the statistic. The biggest cause of death in South Africa of white children is swimming pool deaths. The biggest cause for black children is diarrhea. This little boy who's holding a ball that used to be my son's so tightly survived a bout of diarrhea, but so many children don't. Diarrhea is the easiest illness to cure. Information is the cure. One of our nonprofits was telling me of a story. He's from the Mother and Child Trust. We'll talk about him in a second. He was in an Indian village where he works with the ladies there. And he visited this village on a particular day, and the ladies were very downcast. And he said, well, what's the matter? And they said, well, one of our group, her daughter died in the night of diarrhea. So he went to the lady's hut to give his condolences. And in the hut he saw clean water, salt, and sugar. And he said to me, that little girl didn't die of diarrhea. She died of lack of knowledge. This is actually from the Mother and Child Trust. This is another project of Translators Without Borders. We're subtitling videos into Indian languages so that people can learn in their own language important things like how to orally hydrate your child. 9 out of 10 Indian mothers think that when a child is sick, you need to deprive them of fluids because it's just going to come out the other end, so don't give them fluids, which kills them. 22% of the 11,000 babies that die each and every day could be saved if their mothers knew that bottle formula is not the best way. They think because we do it, they've been told that it's the way to go. The milk can be made with dirty water, can be contaminated, counterfeit, lack the ingredients that they really need for their health. Information is the cure. So we're subtitling these videos, and they're going loaded onto phones that are being distributed in villages in India. This statistic, you must know it came out just a week or two ago. It's a horrible statistic. 28% of South African girls are HIV positive. This corresponds with another terrible statistic, and that's that depending on the country, in Africa, between 1 in 4 and 2 in 4 girls under the age of 22 don't know how not to get AIDS. Yet that information is amply available. Is it in the right language? Information is the cure. This is from the Praekelt Foundation, an excellent foundation that I'll talk about, very technology enabled. In a moment, the people hardest hit by AIDS or by any disease, the people hardest hit are the ones least likely to have relevant information. When I was last in Kenya, this was the big campaign, anti-AIDS. Zip it or use a condom. Zip it or use a condom. If you can get that, are you really in danger? Are you in the at-risk group? This is the problem with speaking to people, not only in English, but in a very hip English. The people who need this information are not the ones who can get that. It's hard to understand really why there's such this misperception, this misconception that everyone speaks English. I wonder if it has to do with when we work with global NGOs, we work with the urban elite, we work with the educated, the urban. We work with people who do speak English, or French, or Portuguese. But when you go into the rural areas where 80% of the people live, they don't speak English at all. The head of the Academy of African Languages, Akalan, said, when you go into a village as an NGO and you're trying to do good work and you're speaking a European language, he says, you're talking to yourselves. The Praekelt Foundation, from whom I've borrowed a couple of slides, has a chat line in South Africa called Young Africa Live, which is like a Facebook for basic cell phones and feature phones. So it's like a community where they get the kids to talk about sexuality, and the idea is to promote condom use. And when they moved to Kenya, they asked the telcos, well, what language should we put Young Africa Live in? And the telcos said, well, English. They asked the users, the kids who would be on in this chat community, well, what language do you want? 60% of them said English, and 40% said Swahili. So the Praekelt Foundation thought, well, 60-40, we should do both, even though it's probably English. Let's do both. So they put the English one up, they put the Swahili up, and almost nobody went to the English community, not even 1%. So what they concluded is that people over-report their comfort. I mean, we're all comfortable in our native languages. They over-report their comfort in English. Oh, we speak English, no problem. But when it comes down to it, when you want to train people, when you want to reach them, you need to reach them in their language, not ours. Nelson Mandela said, if you want to speak to a man's head, speak to him in a language he understands. If you want to speak to his heart, speak to him in his language. And isn't that true for all of us? We wanted to be sure that we really understood that there was a problem before we started trying to solve it. So we commissioned a group that's actually not far from here, about 45 minutes, I think, the Common Sense Advisory. We asked them to look into this for us. Is there a problem with translation in Africa? We never hear about it. Is there really a problem? So they surveyed 364 translators across Africa. And the translators, oh, I hope you can hear me. The translators concluded that 97% of them said that greater access to translated information could help people understand their legal rights. 95% said access to translated information could help them protect human rights. 94% said would have a positive impact on public health. 91% said it would help Africans contribute to the political process. 88% said translated information could help prevent international and ethnic conflicts. And if all these aren't stunningly enough as statistics, the last one, bearing in mind that the survey group are educated professionals, 63% of them knew someone who died, a friend or a family member, because they didn't have access to information. I mean, how many of us have a friend or a family member who died because they didn't have access to information? So here's the good news. It's not all bad news. Actually, I borrowed this slide, so I couldn't update it. But just yesterday I read that it's not 65%, it's closer to 75%. The cell phone penetration in Africa is exploding. It's hard to even keep on top of the statistics. And this is the good news, because before, when people went into the field with information in their own languages, they could be forgiven for it. Publishing is expensive, paper and printing, and there's over 2,000 languages in Africa alone. But now it's feasible. Now it's feasible to talk to people in their own language. Back to Thicke, the village where Muthoki lives. There are more cell phones in this village than light bulbs, and that's true across much of Africa. There are the astounding statistics: more cell phones than access to clean water, than shoes. 25% of people have access to electricity in Africa, yet people care so much about their cell phones. It's their lifelines to so many things, to the new digital world, but to communication, to banking, to all sorts of services. That people who make $1, $2 a day, farmers, will pay 12 cents a day for their cell phones. That's how important they are. And they're important for reaching people. And not only, there are a lot of M-Health initiatives going on, a huge number, if not almost all of them, in English. And that's a discussion I hope you'll have when you're in the field. But it's not just cell phones, it's the internet itself that people are going to have access to. And this is hugely, hugely important. We're getting close to being able to level the playing field. So by 2014, 69% of cell phones will be able to access the internet. Even now, cell phones are outselling PCs 4-1. We thought that the future was going to be cheap laptops. I think it's going to be smartphones. This is one of my favorite slides. So the average African woman touches her hair 37 times a day, checks her phone 82 times a day. I haven't spoken about Translators Without Borders for at least 10 slides. So let me tell you just a little bit about what we're doing. So as cell phones are bridging the digital last mile, you know, that last mile between where the internet arrives and how it gets into people's homes, but we still need to deal with a digital last mile. Putting an internet-enabled cell phone in someone's hand with no content on the internet is no good. There are languages that have, like Hausa, I think 25 million speakers with 300 pages on Wikipedia. Really, we've got the road before us, but we're not there yet. So we're trying to build translation capacity. That's one of the issues that NGOs might be encountering. We're still trying to understand why they're not even thinking of translation as they go into the field with information that they hope to change behavior with. So we think that it might be also the lack of translators. So we're training translators. The bottom group is our full-time facility in Nairobi, Kenya. It's not scalable. It's not covering all of Africa. It's our pilot. It's our attempt to define what is the minimum amount of training that you need to give someone so that they can start getting critical information into the languages of their people. Up top, we have a kind of a road show as well for training, and this was training the Maasai lands. We were training a group of school teachers. It was an incredibly powerful experience. We were talking about the need for materials about female genital mutilation in a group that, well, in a tribe that has 97% FGM. So it was a very, you could imagine, it was a very charged topic, yet they were saying, we need that information, help us know how to translate it. We were working on subtitling a documentary on cholera, actually, speaking of cholera. And in the last day of the classes, I was there, and you see the very traditionally garbed ladies, and one lady stood up and gave the prayer after lunch. Very long and adamant prayer. I mean, a take no prisoners kind of prayer. So I was really curious what the prayer was about. And we were working online to subtitle the videos. So I asked the lady, I said, Dorcas, what was that prayer about, if you don't mind me asking? And she said, oh, I was praying that our internet connection wouldn't go down. So I would say that maybe no one in the world understands the problem of translation as well as the people who don't have it. And they were so keen that we were doing the first video on cholera into the Ma language. FGM is another thing that they need information. It's against the law, yes, but you know what? That doesn't always make a difference. But if they knew that 15% of girls die either during the operation because of contaminated blades or later in childbirth, if they knew that, could that change? So these are our questions, and this is what we're working towards. So we're building capacity. At the same time as we're building capacity, we're also translating specific projects. One of the projects we're translating is from the Open University in the United Kingdom. It has made their health content free for training up healthcare workers. Now remember, I said that I really want these healthcare workers who are taking care of children like Mathoki. I really want them to be trained well. It's so important. So we're translating this health app into Swahili so that people will understand prenatal and postnatal health issues so that they can take better care of the children in their charge. Because the frontline work is really being done by these healthcare workers. If we want to talk about scalable knowledge, and that's where it gets really exciting, scalable knowledge. This is a project that we've just started with Wikipedia. Right now, stage one of the project is for normal Wikipedia. We're translating 80 of the top medical articles into as many languages as we can get them into. I think we're around 80 now, so it's an 80 by 80 project. This is hugely scalable work. We're working with a doctor who's head of Wikimedia Canada, and he's making sure that every word is absolutely vetted and accurate so that we can contribute to knowledge. But there's even more exciting work going on with Wikipedia. Wikipedia Zero, they're making deals, even as we speak, with telcos in the different developing world countries, or majority world, I prefer that, the majority world countries, so that Wikipedia will be free of data charges. And we're talking about a real game changer for people to be able to access knowledge. It just needs to be in their language. So we're working on, I'm not technical, but it's the USSD protocol. There's another project with Wikipedia so that the information can come in smartphones. People can query something like malaria and get 10 concatenated text, SMS messages back to give them the information they want from Wikipedia. So we're working on translating that as well into local languages. I think we can start to get scalable. Because we're talking about disaster relief, I thought I would talk about the Ushahidi platform. It started in Haiti. Actually, it started in Kenya, sorry. But it really came to the world focus, world awareness in Kenya, in Haiti, during the earthquake. So people would send their messages, whether they needed help, whether they had found a survivor, whether they were out of water, to tell a family member they were alive. Those messages would normally be in French or Haitian Creole. So a crowdsourced group, including some of our volunteers, but volunteers from all over the world, would translate those messages and get them to the authorities. During the last Kenya elections last month, we worked on the same platform in kind of the same way. We do crowdsourcing, but it's gated crowdsourcing in that we vet and or train the translators before they do their work. But it's another form of crowdsourcing. So we had our group translate these messages in real time. 39,000 SMS messages came through during the elections. And we translated from all of these languages. Communication is aid. And in this case, remember in 2007, the Kenyan elections, over 1,000 people died. Part of it was because of rumors. This tribe is arming themselves, so we better. And then it became a self-fulfilling prophecy. This is just one of the screens, so you could see they were saying there's peace in Lodiani, we need police officers in Kanal, and tension is rising in Korogocho. So these messages were important. They were fed to police officers, to local authorities, to election observers. And I'm not saying that we had anything to do with those wonderfully peaceful elections, but like everybody here who's working in humanitarian work, we're part of the story. And I think it's important to be part of the story. So at the end of TED Talks, people give their TED wish. And I'm going to give you my Tufts wish. My Tufts wish is that in 10 years, we will have leveled the information playing field. That in 10 years, language won't be a door to knowledge that keeps knowledge from the very people who need it most. That in a decade, we won't have information haves and have-nots, but that everyone will be able to access the same knowledge, regardless of what language they speak, the same knowledge we all need to keep our children from dying needlessly, to avoid preventable diseases, to live healthy, prosperous, and long lives. That's my Tufts wish. Thank you.